This PowerPoint presentation will be over issues with out-of-pocket costs in dentistry. First off, I would like to introduce myself to those who have not formally met me. I am Keela Heisel. I am a wife and mother of 3. I have been a dental hygienist for 15 years, and I am currently furthering my education in healthcare management. I am also an author and co-founder of Tell Her She's Beautiful. I love to travel, spend time with loved ones, read, write, and help those in need. A healthcare issue that affects dentistry is delayed treatment because of patients' out-of-pocket costs. Impact of the issue will be discussed, and how to solve the issue will also be discussed. We will discuss the out-of-pocket cost of dentistry. The cost of dentistry, I'm referring to the out-of-pocket cost, and that is after insurance pays for those who are insured, usually through their employer. All insurances are different. I will give examples of average insurance coverage. Preventative is usually covered 100% by insurance. This includes yearly x-rays, prophy, which is a cleaning, dental exam, assessments, fluoride treatment, and sealants for children. Major restorations include fillings. This is usually covered anywhere between 50 to 80% by insurance. Patient portions are the remaining 20 to 50%. Major restorations includes crowns, root canals, bridges, partials, dentures, usually covered by insurance 50%, leaving a 50% payment portion for the patient. Specialty offices for things like extractions, root canals, ortho, braces. Specialty offices cost more than a general dental office. So a root canal here would cost less than the endodontic office. When we send a patient to a specialty office, we wait until the treatment is complete there before doing any other treatment because the referred treatment may max out insurance. Dental insurance, the last slide, we went over an overview of dental insurance and patient portion. This slide will explain a little more about out-of-pocket costs. Yearly max. Dental insurances have a yearly max of what they cover, usually anywhere between $1,000 to $1,000 to $3,000, with the average being more around 1,000. 2 crowns can easily max a patient out for the year. The patient has to wait until the next fiscal year for more coverage, including preventative coverage. Deductibles. Some insurance companies have deductibles a patient has to pay before any procedure is covered. This includes preventative procedures. The deductible is usually $50, sometimes more. Approvals. Sometimes insurance do not even approve what needs to be done, leaving the patient with even more out-of-pocket costs. All these reasons are more reasons patients have a large cost for the treatment that need to be done and why treatment is delayed or avoided. So, patients delay treatment because of cost, but that actually increases the cost of treatment because now they need more treatment. The impact of the issue. And ooh, look at there. Not a good one, as you can see. The impact of the effects of avoidance or delayed treatment because of out-of-pocket costs. So, how avoidance and delayed treatment affects dentistry, disease. So, patients have or need treatment because they have disease in their mouth. So you need a root canal because you have infection. You need fillings because you have decay in your teeth. So treatment is treatment because of a condition, and the condition is a disease. The disease also it spreads throughout the mouth. It gets larger. So a filling can become a crown. A crown can become a root canal. A, a root canal that was needed can eventually just need the tooth to be extracted. So it gets larger and it costs more. Yes, extraction of a tooth may not cost as much as a root canal, but extraction of a tooth costs more in the mouth because now you have movement. Now you can't eat right. Now you have movement from the teeth beside that and the teeth above or below. So one tooth missing shifts everything in the mouth. So it actually costs more. Production, yes, we're here to treat the patients. Yes, the patients are our first priority, but we have to make production. We have to keep the lights on. We have to make sure we have all our equipment. We have to make sure all the bills are paid. All the employees have bills at home. The employees need to be paid. So there's reasons why we have to make production. This is a business. If patients are getting their treatment done, we aren't making production. And the treatment is needed. So it's not like we're creating a need. The need is there. Cost. The effects of the patient not getting treatment affects their health. So it costs more for them not to get treatment. It'll cost more in the long run, maybe because a filling turned into a partial or a denture. So that denture costs more than that filling. So it costs them more in the long run, and it also costs our business because we're losing out on production that can be made. How can we solve this issue of delayed treatment or avoidance because of out-of-pocket cost of dentistry? Some solutions to avoiding patients getting treatment done because of cost. So the first is make sure the patient is in network, and that helps avoid out-of-network prices, additional prices. Speak to the patient about a dental savings plan. Maybe it's available through their job, or maybe they can save on their own. Offer care credit that can help cover the expense, and the patient's able to pay on that. Break up appointments and treatment. See what is affordable for the patient and kind of break it up accordingly. Offer a payment plan. And I know a lot of dental offices do not like to do this, but the benefit of being a dental office, we get that experience, that relationship with our patients, and those that we know who are good at about paying, we can maybe extend that to them. That's an option, doesn't have to be done. So those are ways to avoid patients delaying treatment. What can managers do? Educate. Make sure everyone understands what's going on and what needs to be done. Training. Make sure those involved are competent to perform. Implementation. Take action. Evaluation. Make sure the changes are working. Here are my references. Any questions? Thank you all so much.